So my name is Alicia Huckleby, and I serve as the Human Resources Manager and the Resident Initiatives Director at the St. Paul Public Housing Agency. My mother grew up in public housing in Chicago in the 50s and 60s, Robert Taylor homes. And there wasn't a lot of opportunity and there wasn't a lot of hope there, which is why they moved here to Minnesota. So for us to be able to play a role in the lives of residents in this way with our partners it is a humbling experience. And it's really an amazing thing to watch when people are not only presented with these opportunities, but they take advantage of them. And you see that they give people hope.
I have two favorite programs. One is our connection with Metropolitan State University. The nursing students there come and do health fairs and foot care clinics and mental health in services, things for our residents that they really find beneficial. My other favorite is our visiting veterinarian who comes and makes house calls to the folks who have pets in the high rises, and that's a huge benefit for them because it's hard for a lot of them to get their pets out for regular care. So it works out great.
Because of the building we live in is assisted living, people can't get out, so it's nice to have as much in our building for people to do. I've worked on a couple of the garden committee and the exercise room. It's a way for people to come together and socialize and build bonds, and it makes for a closer community.
One of the most successful has been the HAFA program, the Hmong American Farmers, bringing vegetables and just bringing vegetables to consume, but also being part of a community where we've never had that before at the high rise, where folks could choose fresh, good things to eat. We make it part of our CHSP program. We distribute fresh vegetables, recipes. So we now have conversations around good, healthy food, which we haven't had in the past. We have vending machines in all the high rises, working with our vendors to start changing out on healthy foods to healthy options. We have community room computer stations, Wi-Fi, Skype. We just improve all the time. It's the 21st century. PHA residents care about technology as much as the rest of us.
In my opinion, the partnership between St. Paul PHA and the Minnesota Department of Revenue is one of the most beneficial programs. This program started in 2001, and since then, the past 14 years, I've been able to help residents file millions of dollars in tax return that essentially goes back to the community and the economy. Taxes alone can be very intimidating, and for us to bring in this partnership allows residents to reap in the benefit of a free service in a non-intimidating environment.
Out of all of the programs that I'm involved in, I'd have to highlight our partnership with Free Bikes for Kids. This past December was our third year in our partnership with Free Bikes for Kids, and we gave away almost 270 bikes, helmets, and locks at the 4 family sites here. And looking back over the past 3 years, we've given nearly 750 bikes, which is it's really incredible.
Over the, last 3 years or so, we've found all kinds of opportunities to encourage and provide resources and tools for the residents of St. Paul Public Housing to improve their health and wellness and generally their quality of life. It's ranged from projects like Free Bikes for Kids, free shoes for kids, starting up walking clubs, and talking about improved nutrition and different ways to cook healthier.
I believe that the mobile food shelf that we have in the high rises is one of the most beneficial programs that we have. That's the partnership that we have with the food group. Our human services coordinators are awesome in coordinating that. And it allows for residents to be able to have nutritious food, and it encourages healthy eating. Not to mention that they don't have to travel anywhere.
So our SHIP funding is statewide funding that goes to every county throughout the state of Minnesota, and it's funding meant to help improve the health of everybody living in Minnesota. I feel that with our healthy living work, as well as all the other work going on in resident initiatives, we're working to help these people break down whatever barriers they have to seek out whatever they're trying to do, if it's just to feel better, to get healthier, spending more time with their family, job training, more skills. I just think what we're doing is really valuable and important.
Well, I think it definitely encourages independence. It allows for residents who are maybe struggling financially, which are our residents, to have a sense of dignity and respect.
Sometimes the high-rises can be isolating, but when we have these great partnerships, it gives people a sense that yes, they are valued and appreciated as members of the community, and it really works out great for everyone.
You know, they care about exercising and bike riding and eating healthy and being able to use a computer. They care about all those things. And I think now our community partners have met and worked with lots of really great, interesting people with really interesting stories. And likewise, our residents just benefit tremendously from everything.
It was a Central Minnesota Resource Program, and I did with a lot of Word, Excel, and emailing, and doing PowerPoint. And it was very educational. It was a great advance to my capabilities because I didn't know how to do any of those things until now. So I'm privileged. I feel privileged having taken that program. It make me able to communicate more on the computer and look for work, and I'm really excited about it. I mean, I've learned an awful lot, and I'm still practicing it. I learned how to type, and which I didn't know how to do. So I'm getting better each day as I go along.
I just think I'm very thankful for the grants because they really do help us a lot in our building, bringing things to our residents because it makes for a healthier, happier life for us.
I'm a board member at St. Paul Public Housing. I'm one of the board members. I represent the family units as a board member. I'm also the president of the Needy Resident Council in here. Having an ACOP, being around and seeing them around, feel safe. The other one is having computer lab in our area is really helpful for those who doesn't have a computer or any internet to use it. Having those things on the site really help people to get a job and to be independent as well. Those things kind of bring the community and feel the presence of the resident being connected. Additionally, what I say is I'm a student as well, and having different kind of support around me, so I really appreciate those things.
It feels that we have brought the community, the greater community, into our high-rises, and the greater community now knows who our residents are and has probably gained a tremendous respect for them.
Personally, I'm excited about it and really, frankly, honored to have these partnership opportunities. It's the new way we're all thinking about healthcare and health, community health generally. So it's a great opportunity no matter how you look at it.
My favorite service or program, well, fortunately I can't be biased, so I'll say it's pretty much any service or program that allows someone to meet a need or to make a difference in their life. And whether that's providing an individual with the ability to compete more successfully for a much needed job, or whether it's having an on-site healthcare provider for those who are homebound or who have limited mobility, or even just the opportunity for individuals to be involved in recreational activities. All of those things together help empower people.
I'm excited, and I count it as a privilege, and I take, advantage of it, because I don't know when an opportunity like this may come along again. And I just thank Public Housing for everything they've done.